NTU is partnering with Imperial College London for this medical school. I think this partnership is unique. You can say that the top of the West partners with the top of the East.
It's a great honor for Imperial to be collaborating with NTU on Singapore's newest medical school. Imperial and NTU are world-class universities that share a common vision that bringing together science, engineering, and medicine will produce tremendous discoveries.
This will help to augment Singapore's healthcare manpower needs, while providing more opportunities for Singaporeans to pursue a world-class medical degree in Singapore.
Our school will not only nurture doctors with the competencies that match the demands of modern medicine, but will also be a centre for innovative research that will improve healthcare.
There is no doubt that the very best medical schools in the world combine excellence in research with superb education. We really had the unique opportunity here to create a bespoke curriculum, taking the very best of everything that's delivered in the Imperial College setting and make it particularly appropriate for Singapore.
I foresee that with the new medical school, the whole university's research will have a totally uplifting effects across the university. The medical school will provide other colleges, humanities, engineering, science, business school, another good reason to have interdisciplinary research and lift up their research a quantum level higher.
Our research goal is to address the healthcare challenges of Singapore's ageing population, focusing on neurodegenerative disease, mental health, skin and metabolic disorders, and infectious diseases. Our researchers will spearhead healthcare innovation, delivering improved therapeutic outcomes and better quality of care for individual patients.
Over the 5 years, the students will be learning a lot about integrated care and interdisciplinary healthcare. Patients today have multiple medical problems. They see multiple specialists. So we want to train our doctors to be able to work with different specialists, to work with other healthcare workers like nurses, podiatrists, physiotherapists, occupational therapists, social workers in an integrated team so that they are all able to bring their expertise together to bring the best for the patient. So over the 5 years, we'll teach students how to work as a team, how to interact with different specialties, and one day they'll be good doctors.
We are privileged to have amongst our teaching faculty many of Singapore's top clinicians, as well as a world-class team of scientists. So our students will be well versed in the scientific basis of medicine, but this science will be learnt in a clinical context. And we will use innovative ways to deliver our curriculum. So students will learn through team-based learning, through simulation and through e-learning. And all our students will have iPads, so they will be able to access their curriculum materials at a time and a place that suits them.
We've designed our simulation curriculum so that at each step of the way, the student can practice each of their new skills in a safe setting before they try it with a real patient. They can practice those really difficult skills with simulated patient. Trained to give feedback to the students, and this means the students learn how the patient is experiencing their consulting technique, and that's very powerful.
Team-based learning, and what we do, which is different from normal teaching, is we flip the classroom around. Students do their homework before coming to class. When they come to class, there's something called a readiness assurance process, where they answer questions and get immediate feedback on how well they understand their homework. And this prepares them for the application session. It's an opportunity for students to apply what they've learned to real scenarios and to understand the significance of some of the concepts that they've struggled with throughout the rest of the day. And that really allows them to get into the heart of what they're learning.
LKCMedicine's learning pedagogy really appeals to me. In particular, the team-based learning approach allows us many opportunities to cultivate our teamwork skills. I also like that LKCMedicine places a lot of emphasis on simulation. By first working with simulated patients, this will allow me to handle real patients much better.
As a medical educator, we are training the next generation of doctors who will embrace new technologies, that start with the patient, put the patient in the center, and share the journey with the patient.
We are very fortunate to work with the National Healthcare Group as our primary healthcare partners. This will give our students the chance to interact with patients as well as with other healthcare providers so that they will have the full hospital and caregiver experience during their 5 years of education. Our facilities will be able to enhance our team-based learning as well as our technology-enhanced capabilities, such as the use of simulation and the use of special communication skills. And to what purpose? So that we are able to prepare the future doctors of Singapore. You know, the doctors you and I would like to have caring for us.
It has the dedication of world-class academic and administrative leaders and staff, unrelenting support from NTU and Imperial College, and a strong mandate from the Singapore government to produce outstanding doctors for Singapore.
The innovations we are making in the LKC course provide new approaches to teaching medicine that can be used all over the world, including here in London. This will be a profound legacy for Imperial, educating 21st century doctors for Singapore.
It's quite clear that this will be a world-class medical school, world-class in its medical curriculum, and put Singapore on the world map of medicine.